Hello and welcome to our first module in the series, Clinical Medication Reviews in GP Practice. My name is Adrian Murphy. I'm a Senior Clinical Pharmacist at Clinical Pharmacist Solutions. I have worked in multiple GP surgeries and have done countless medication reviews. I've also trained several pharmacists. Over time, I've realized that pharmacists need help understanding the difference between medication use reviews that we perform in the community and clinical medication reviews that we perform in GP surgeries. So what is this training based on? We have based it on the NICE guidelines NG5 and the NICE quality standards QS 120. We also use NICE guidelines for each condition, the summary of product characteristics for each medication, BNF monographs for each medication, and a combination of various CCG guidelines, also the Oxford Handbook of General Practice for red flags. And we put this all together using a combination of experiences of several senior clinical pharmacists working in GP surgeries. We will start by looking at the general structure of a clinical medication review, and then we will look at how to apply this to specific conditions such as gout, hypertension, and so on. Clinical medication reviews must be safe, efficient, and evidence-based. To do this, we need to know what questions to ask specifically, and what blood tests to request, and what is expected to be acceptable and what is not. Before we continue, I just need to clarify what this training does not cover. This clinical medication review training does not cover how to run chronic condition review clinics, or how to manage the chronic conditions not under control, or how to up-titrate medicines for a given condition. And it does not replace annual chronic condition reviews such as asthma annual reviews or diabetes annual review clinics and so on. Chronic condition review clinics are covered in our level 3 training programs such as the A to Z of running asthma clinics or the A to Z of running heart failure clinics and so on. So, the general structure of a clinical medication review. By the end of this module, you will know how to start a clinical medication review consultation, become aware of the types of monitoring requirements for a clinical medication review, understand the difference between medication monitoring and condition monitoring, the 7 steps to carry out a clinical medication review, and finally you will know how to close the consultation, including safety netting. The general structure of a clinical medication review. So, if you are conducting a clinical medication review in a GP surgery, be it over the phone or in person, the patient will be on regular medications that appear on their repeat medication list. The patient will have already been diagnosed and usually stabilized on these medications. Your job during the clinical medication review is to make sure the patient should only be on medications that they need and are safe to continue with. To do this, it's best to follow the below 7 steps. Firstly, you open the consultation by introducing yourself and setting the expectations. Then open the repeat template in their patient records, and then you start going through each of their regular medicines in turn and make sure the monitoring requirements for the medication and the condition it is being used to treat are being met and are up to date. In some conditions, you may need to do other monitorings as well. Once you have done that, you then can suggest and agree on any changes and give advice or refer to a more senior clinician as necessary before closing the session. The opening. Once you have the patient with you, introduce yourself and then confirm their name and date of birth. Don't start going into the details of the consultation before completing this step. Then, outline the purpose of the medication review. Agree on how you will conduct the review with regards to the structure of the consultation. This may be like, we will go through each of your medications on your repeat list to see how you're getting on with them. Is that okay with you? Once you set the scene and the expectations are laid out and agreed upon, then ask them, how are you getting on with your medications in general? Are you experiencing any problems or side effects? And give them 1 minute to talk without interrupting. In practice, we call this the golden minute. If you can let your patient air anything that's on their mind, such as pressing issues or concerns, they are more likely to engage fully with the medication review process. Medication monitoring. Open the repeat list on the patient medical record and start going through each of the medications one by one. You may want to group them as per an indication. In order to cover medication monitoring, you will check, is there an indication for this medication? Has the diagnosis been recoded and assigned to the medication? If not, you should assign it, but do not add a new diagnosis unless you're competent to do so. Check with the patient, do they know why they're taking this medication? Understanding the indication will help them with compliance and give them an informed decision if they decide not to take it. Next, check that the patient is compliant with their medication. Check that they are taking it as prescribed. Ensure that they are not overusing or underusing the medication. You can also do this by looking into the quantity and the frequency of past issues. Ask them if they're experiencing any of the common side effects for this medication. For example, ankle swelling for amlodipine, oral thrush with steroid inhalers, etc. This will be covered in more detail in the following modules. While they are answering, you can check the patient records for recent blood tests and any relevant examinations. You may want to use some screening tools where applicable. Then check the dosage is correct for the patient's age, kidney function, liver function, and so on. For example, citalopram dosage in the elderly, apixaban dose adjustment, or ramipril dose capping with low EGFR, etc. Is the medication still indicated and does it meet the current guidelines? For example, long-term use of quinine or benzodiazepines or Z-drugs. Consider the anticholinergic burden, considering the risks and benefits of the medication. Then consider medicine optimization switches such as branded to generic and suitable alternative switches. And so there will be a full list of your suitable alternatives in your CCG formulary. As a clinician working in a GP surgery, you must be familiar with your local CCG formulary and have a copy available to you. Once you have gone through all the medications, make sure you tidy up the repeat template list. Check the quantities are aligned, the issue duration is set correctly, review dates and maximum number of issues are also set correctly, and if possible, synchronized for the patient. Condition monitoring. Then you will need to check if the monitoring of the condition is being met. To do this, you need to check that all the relevant tests and examinations and checks have been completed and are acceptable. For example, diabetes, asthma, COPD, hypertension, and heart failure annual reviews have been done in the past 12 months, and any follow-ups from these reviews have been actioned. You should also check if there are any outstanding QOF indicators and action them, or if not, refer them to be actioned. You may want to screen the patient for any relevant risk of complications. Next, ask the patient if they understand their condition, the potential complications of the condition, and whether they would like more information. Then, ask them more probing questions to find out about the progression of the condition and whether it's getting worse, pretty much the same, or better over time. If it's getting worse, you need to book them in with an appropriate clinician who can then manage their condition, which could be yourself if you have done our level 3 training. Also, for certain conditions, you need to check if the patient is having any exacerbations or flare-ups. This will also inform you on disease progression. This will be covered in detail in the following modules. So we have just looked at the medication monitoring and condition monitoring. Let's now look at the difference between them. Medication monitoring is all about the safety of the medicine. The reference sources would be the BNF monographs, summary of product characteristics, and for some medicines, nice prescribing information found in the guidelines. Condition monitoring, on the other hand, looks at the disease progression with the aim of optimizing the control of the condition. The reference sources would be mainly the NICE guidelines and also some other clinical reference books. I think it would be easier to understand if we look at an example. The patient is taking metformin for diabetes. The medication monitoring would involve a blood test for UNEs, where eGFR is calculated, and if it drops below 30, metformin would become contraindicated and would be stopped. Condition monitoring, on the other hand, is checking for the disease progression. This would involve monitoring the HbA1c, which would indicate the disease progression, and UNEs, which would indicate any kidney damage due to the diabetes. Annual diabetes review would cover several more aspects, such as foot check and ACR ratio, and so on. Any other monitoring. This list can be viewed as a guide of things you could consider. It is not an exhaustive list, so feel free to add any other considerations that you may deem suitable depending on the condition the patient has. You will need to check with the patient if they're taking any other medications that are not on the patient records, such as their over-the-counter medications or medications they may receive from secondary care. Social and occupational history would be important in some instances. For example, a patient on citalopram for depression. Understanding their lifestyle will help you give more relevant advice, and ascertaining their family medical history can give you an insight into their hereditary risks of developing certain conditions. Make changes and give advice. Now you've gathered all the necessary information. Summarize the findings, and if appropriate, you can make suggestions to stop, start, or adjust medications. Always check with the patient if they are happy and ready to go ahead with the changes. You can then give the patient relevant and specific advice on their condition, medications, and lifestyle. We will look into specific examples in the following modules. Be aware, only make changes if this is within your competence. If not, then you will need to refer. Red flags and referrals. So there are 3 types of referrals. Urgent referral to emergency department or to an on-call GP in your practice. This is done if there is an urgent red flag. Again, specific examples of all the red flags are covered in the following modules. If the condition is not well controlled or you discover abnormal results and it is not within your competence to deal with them, you will need to refer them to a more senior clinician or a GP. Occasionally, patients will need to be referred to the specialist. This is especially common when the patient was under a specialist in the past and was discharged back to our care when the condition was well controlled. If you are not sure, it is always good to check with a more senior clinician before making the referral. Most of the time, the GP will have to get involved in specialist referrals. The closing. Now you have gathered all the necessary information and agreed on any changes. The final step is to summarize the findings, the changes you've agreed, and the advice you have given. Discuss the next actions, including further monitoring required, be it a blood test or an annual review with the nurse. Make referrals or signpost them to additional sources of information. Agree on the next follow-up date. At this stage, you can book them in to an available appointment slot with the appropriate clinician. This ensures the follow-up happens. Check if the patient has any questions. And finally, always remember to safety net. Safety netting should include who to contact and when to contact, and must be recorded in the notes. Again, more specific examples are covered in the following modules. To summarize, firstly, you open the consultation by introducing yourself and setting the expectations. Open the repeat template in their patient records, and then you start going through each of the regular medications and making sure the monitoring requirements for the medication and the condition it is being used to treat are being met and are up to date. In some conditions, you may need other monitoring as well. Once you have done that, you can then suggest and agree on any changes and give advice or refer to another clinician as necessary before closing the session. By now, you should know how to start the clinical medication review consultation, be aware of the types of monitoring requirement, for a clinical medication review, understand the difference between medication monitoring and condition monitoring, and know the 7 steps to carry out a clinical medication review, including safety netting. We have now covered the general structure of a clinical medication review. Let's look at a clinical medication review in practice, focusing on a specific condition. To do this, we need to know what questions to ask specifically and what blood tests to request and what is expected to be acceptable and what is not. Clinical medication reviews must be safe, efficient and evidence-based. Let's now see how we can apply the 7 steps of clinical medication review to a specific condition. Part 2, Clinical Medication Review, Gout Medications. Without this training, your clinical medication review for allopurinol might look something like this. Are you taking your allopurinol daily? How is your gout? Have you had any flare-ups recently? Okay, please continue taking it regularly. But now, let's find out how it should be done instead.